So hello everyone. Am I back? Am I live? Can you see me? Can you hear me? Just a second. So can we start the next? Let everyone join. Give me a minute. Let everyone join. We will start in a minute. So everything is good to go from in Lalit, visibility, audibility, everything is good. I told you now, few viruses medico, 4 5 viruses are left. VDPV, Sasika, it's vaccine derived polio virus. One is vaccine associated, one is vaccine derived. So there is few differences between them, but ultimately both are due to vaccine. So let everyone join. I will start. So basically 5 more viruses, RNA viruses, I have to continue. All DNA are done and maximum RNA are also done. We have completed picorna right now. And now I'm starting with rhabdovirus. So let's start with rhabdovirus, the rabies virus. After that, I will teach you HIV and ortho and paramyxo. That's it. So maximum RNA, I mean the all important RNA will be covered. And DNA we have already seen. So let's start the next virus, rhabdovirus. So here I am teaching you rabies. Rhabdovirus. The rhabdovirus is the rabies virus. है ना? Rhabdovirus is the rabies virus. The first thing, have I taught you it's bullet shaped? जहाँ मैंने सारे shapes बताए. Where I taught you all the shapes. है ना? So I told you it is bullet shape. है ना? You can see the bullet shape. You can appreciate the bullet shape. This is bullet shape. You get an image based question on that. The bullet shape virus. Never forget, it's a bullet shape virus. You can get a question on that. What is the route of the transmission? The route of the transmission is the dog bite. Can you see a dog? It is present in the saliva of the dog. So whenever the dog is biting to some human, the virus present in the saliva of the infected dog. This is not a healthy dog. The dog is having the rabies. This is an infected dog. So when such an infected dog bite the human, the saliva get deposited on the wound. Via saliva, the virus enters inside. The via saliva, the virus enters inside. So what is the route of the transmission? Most common route of transmission is dog bite. So virus present in the saliva get deposited on the wound. Number one. Sometimes the dog is just licking, not biting. Licking. सिर्फ licking कर रहा है. The dog is just licking. You can see in the image. है ना? Licking, not biting. So the person already have the abrasions on the skin. Maybe the person is having the abrasions on the skin, and on the abraded skin, the dog is doing the licking. You got my point? So the saliva ultimately go inside, and in this way also it get transmitted. So bite of the dog, number one. Licking on the abraded skin, number two. Number three, it don't occurs only in dog. It occurs on all wild animals. All the wild animals can have rabies. In wild animals, I mean dogs are there. Obviously, dogs to hang. After that, wolves are there, jackals are there, foxes are there, Hannah, bats are there, and all the wild animals rabies, warm-blooded animal rabies can occur. But in cities where we live, we are exposed to dog. Cities में wolves, jackal, foxes तो नहीं होते ना. Bats. What about the bats? Bats remain in caves. This is a cave. This is a cave. Inside which bats are there. This is a bat's cave. So all these are the bats. These all are the bats. Some human is passing from such a cave in which bats are there, and one of the bat is infected. Imagine one of the bat is infected. So via inhalational route it can go inside. Inhalational route via the spores. So it can also be a rare route. Inhalation of the aerosols generated in the bat cave. One of the bat is having the rabies. Say yes. Number four, whenever the dog have the rabies, the dog become mad. The dog become mad. It bite everyone. Normally dog don't bite us. If we provocate, if you go and provocate the dog, भाई छेड़ोगे तो काटेगा ना, ऐसे थोड़ी काटेगा कोई dog. The dog do not bite usually, but if you provocate the dog with something, then bite. But rabid dog is mad. Without provocation, the dog bite everyone. Sometimes you may have heard the dog become mad and is biting everyone. It is a rabid dog. So whenever it bite the human also become mad like the dog, and humans start biting other human. So human to human transmission only with the bite. Rare cases it can occur. So the human start biting other human. Not normally when the human have the rabies. The human also become mad. Okay, got my point? And corneal and organ transplant. So there are 5 ways. What are the 5 ways? Please learn the 5 ways. Number one, dog bite. Number one, the dog bite. Okay. Number two, the dog lick. But dog lick is on abraded skin. Make sure, not on intact skin. Number two. Number three, bat cave. Bat cave may it is aerosol if one of the bat is infected. Number four, human to human, man to man bite, and it's rare. And fifth is corneal transplant, corneal or organ transplant, right? So basically, the virus is present in the saliva of that animal. If you are considering animal as dog, it's dog. So dog ki saliva mein it is present. है ना? See the pathogenesis, everyone on the screen. It's very important. Whenever the dog is biting, the virus present in the saliva of the dog get deposited in the wound. The virus get deposited in the wound. After getting deposited in the wound, the virus go deeper in the muscle. The rabies virus, the rhabdovirus go deeper in the muscle. After going deeper in the muscle, the virus get attached with the nerve. We have nerves everywhere. So wherever the dog is biting, wherever it is biting, the virus get attached with the nerve and it will ascend upward, 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 upward. It will go to the spinal cord. It is going upward, upward, upward. It reaches the brain. So ultimately, virus reaches the brain. In the brain, it destroys two areas. Please learn. Number one, hippocampus. Number two, cerebellum. Hippocampus and cerebellum is damaged by the virus. Please learn. Hippocampus and cerebellum. It is damaged by the virus. Say yes. Say yes. Got my point? So this is the pathogenesis. Not only this, this is known as centripetal. So wherever is the virus, it is going towards the center. The center is the brain. So first it is going centripetal distribution. After going to the brain, it will go centrifugal. So it will go to the nerves, multiple nerves, and it will go to the salivary gland, it will go to the eye, it will go to the cornea, multiple organs. So this is centrifugal. First, from the site of the bite to brain, number one, and from brain to multiple organs. So this is the route. First from the site of the bite to the brain, and then from brain to the multiple routes. So first it is centripetal towards the center, and then it is centrifugal, that is away from the center. How many of you got it? First it is centripetal, then centrifugal. How many of you got it? Saeed, Suji, Lalit, you got it or you didn't got it? Please keep responding. So this is the pathogenesis. Everyone got it? Listen, I told you whenever the dog is biting, the virus start ascend, upward, 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 upward. You must ask me, ma'am, what is the speed of ascent? What is the speed of ascent? Daily, the virus go 250 millimeter upwards. 250 millimeter one day. 24 hours में कितना ऊपर जाएगा? 250 millimeter. जरा सा 250 millimeter. Learn the speed. 250 millimeter per day. This is the speed at which the virus is ascending. Now let me tell you two human. This is a human, है ना? And this is also a human. ठीक है? Both of them have dog bite. To this human, the dog has bitten on the foot, and this human dog has bitten on the face. Dog can bite anywhere, I know. So which will have rabies fast? Which will have rabies fast? You use your common sense and tell me. So here also it will go via nerves and reaches here, and here also it will go via nerves and reaches here. You see the route. Daily the virus is going 250 millimeter per day, है ना? So here it will be fast. Here it will be fast. So here within 7 days, यानी 1 week, the person have rabies. Here it will require 1 month nearly. So my point is that incubation period is variable. It can be 1 week to 1 month, very variable, depending what is the site of the bite. So whenever the bite is on the face and the neck, rabies is very fast, and whenever it is on foot, it is slow. So this is the reason. It's a PYQ. Understand it. It's very easy to understand. Once you understand, you will never forget. Once you understand now, you will never forget. So same story is written. So first there is a dog who is biting. So the saliva of the dog going in the wound. Then it will go in the muscle. Then it will go in the nerves. Then it will ascend upward at 250 millimeter per day. Then it will go in the brain. In the brain, it destroys two areas, hippocampus and cerebellum. Hippocampus gone, cerebellum gone. Then it will go centrifugally to multiple organs, skeletal muscle, heart, adrenal, skin, salivary gland. See, after going to the brain, it is going to multiple organ. One of the organ is salivary gland. Now, this person will bite another person. So that person will also have rabies. So this person is like dog now, having the virus in the saliva. Got my point? Got my point? Okay. And finally, it is shed in the saliva and it can bite to another animal. Say, what you're asking, say, didn't got it. Even it's inside the body means, I didn't got it. Okay. So, ma'am, can we prevent it by, I'm coming on the vaccine. No, say it. Yes. We can prevent it with the vaccine, even if it is inside the body. Yes, definitely. I'm coming on the vaccines. Okay. So this is the pathogenesis. Now, what is the disease rabies? In the rabies, we have 3 phases: prodrome, neurologic phase, and coma. In the prodrome, patient have pain at the dog bite. At the dog bite, the patient is having the pain. Obviously, it depends on the height of the person, Srinike, the same concept. In children, the height is less. In adults, the height is more. So in children, the rabies is very fast, and in adults, it's slow. And in different height, in dwarf, it is fast. In tall person, it is slow. But ultimately, rabies will occur. Whether it will occur after 1 week or 1 month, it matters, incubation period, but ultimately it occurs. If it occurs, there are three phases. In prodrome, there is pain. There is pain, simply pain at the dog bite. That's it, pain in the nerves. After that, the most important is the neurological phase. In neurological phase, the hallmark is hydrophobia. The patient is fear of water. Patient can't drink water. Patient can't see water. Drink to छोड़ो दूर की बात है. Patient can't drink even on severe dehydration, severe thirst. Patient will not drink water. Patient even can't see water. आप water दिखाओगे, patient larynx will go in choking, and attempts to drinking will cause choking. Not only this, patient can't hear the sound of the water. If you are opening the tap somewhere in the bathroom, hearing the sound of the tap, patient will go in that X. So hydrophobia is very severe, deadly hydrophobia is there. Ultimately, patient will go in coma, convulsions, and death. There is no treatment of rabies. Only symptomatically you give the treatment. Sometimes you can save the person, sometimes you cannot. Most of the time you cannot. It's a deadly disease. The cerebellum is gone, hippocampus is gone. Patient have severe hydrophobia. Symptomatically you try, but there is no firm treatment that we can say. There is no treatment of rabies, but rabies is preventable. Got it? Rabies is preventable. There are certain areas in the brain which are destroyed, which is causing hydrophobia. Exact mechanism not known. Cerebellum, hippocampus gone. That is for MCQs, you know, right? Exact mechanism not known, but it is the hallmark here. Say yes, hydrophobia, right? Now, if the person is dead, imagine this boy, this person is dead, Hannah. So it is, the body is coming for the postmortem, autopsy, Hannah. We are doing the autopsy, the postmortem of the dead body. So they will give you a history of the dog bite. So dog bite ki history ke baad, there is a death of some person, we will open the brain in the autopsy. In the brain, we will take the brain out, we will cut the brain, and we will look for negri bodies in the hippocampus and the cerebellum. Again, two location, hippocampus and cerebellum, you will get the negri bodies. What are negri bodies? You know negri bodies. So these are intracytoplasmic inclusion body. You can see a brain cell. You can see the nucleus. You can see the nucleoli. See the cytoplasm. In the cytoplasm, can you see some pink colored dots? These pink colored dots are negri bodies. The pink dots are negri bodies. Got it? So negri bodies is the hallmark. In live patient, there is no way of diagnosis. There is no way of diagnosis because we cannot take a brain biopsy in the live patient. So in live patient, there is no need of diagnosis also. It's very clear. Dog history, dog bite ka history hai. And after that, the person is having hydrophobia. It's obvious it's rabies. We don't need any diagnosis. But after the death, for confirmation, we do the autopsy, right? In dead person, we get the negri body, not in live. That I'm telling you, right? Okay. No, not Aulai appearance. Sasika, you are telling Aulai here? No, it's Negri. It's Negri bodies here, not Aulai. Aulai was in CMB, right? You are getting confused. Anyways, Shalo, what I was telling you, yeah. One more thing. The dog has bitten, na? The dog has bitten the man, the person, the human. Hana? So there are two things. After bite, immediately trace the dog. Trace the dog for next 10 days. It's a protocol. Trace the dog. If the dog is dying, the person is going to die. Anna, if the dog is surviving, the person is going to survive. It means the dog is having the rabies or do not having the rabies. Got my point, Anna? So trace the dog. And if the dog is also rabid, now sometimes we cut. If the dog is dead, so we cut the neck of the dog. We take the head to the laboratory and we see the negri bodies in the brain of the dog also. So we can get negri bodies in the dog's brain, in the man brain, but both of them should be dead for getting the negri bodies. That is the point. Say yes, people say yes. Jaldi yes, bolo. Anna, got my point. Anna. So that is the negri. Now, someone was asking for the prophylaxis. Now, there is no treatment of rabies. No treatment. But prevention is possible. Anna. Now, there are two type of prevention. There are two type. After dog bite or before dog bite. Anna. The one is post-exposure. One is pre-exposure. Post-exposure matlab after the bite of the dog, after dog bite, है ना? And pre-exposure is before dog bite. So maximum people take after dog bite only. If a dog bite me, then I will go for the vaccine, है ना? But pre-exposure is required for the veterinary doctor. The veterinary doctor, the person who work in the zoo, the person who work in the forest, the person who are in close contact with the animals due to their profession. So they have a fear that anytime they can have a dog bite or any animal bite, है ना? In that case, they can have a pre-exposure prophylaxis. So we have both protocols. We have both protocols. Say yes, people. पोस्ट एक्सपोजर प्री एक्सपोजर प्रोफाइलैक्सिस, ठीक है. So let me tell you the two prophylaxis, post exposure pre exposure both, है ना. So what is the route? There are two routes, intradermal, intramuscular. I will tell you both schedule. In adults we give it on deltoid, in children we give it on thigh, anterolateral thigh. If adult, vaccine is given on the deltoid, right and left deltoid, and in children it is given on the thigh, anterolateral aspect of the thigh. So adults में deltoid, बच्चों में anterolateral aspect of the thigh. You can see in the diagram. Now let me tell you two protocols. It's difficult. I'm warning it's difficult, and I'm saying I will not repeat it. Please concentrate. I mean, okay, I will repeat it, but please concentrate. Listen. Chalo. Let me tell you post-exposure prophylaxis. Post-exposure is after dog bite. Imagine a man is coming to my clinic. That ma'am, I'm having a dog bite. See, today only a dog has bitten. And I was going to my office, and there is a mad dog in our society, and I have not provoked it. Still, he has bitten me. So I have heard that after the dog bite, rabies can occur. I do not want to have rabies. Can you give me some medicine, some vaccine, something? So I will explain to the man, okay, the vaccines are available. Then I will ask the man, two protocols are available: intradermal, intramuscular. Which one you would like to opt? So the man will ask, ma'am, what is the difference between the two? Can you please explain the pros and cons and the differences between the two, the scheduling of the two, and the costing of the two, so I can opt one. So I will explain both the protocol. Whatever the man will say, I will give that protocol. Both are equally efficacious, right? Intradermal, intramuscular. The route is different. So let me tell you, इंट्राडर्मल आई विल एक्सप्लेन द मैन दैट आई विल गिव यू टोटल. अच्छा, पहले के जमाने में कहते थे कि डॉग बाइट हो. व्हेन आई वाज अ किड ना, माय मदर यूज्ड टू टेल मी डोंट गो आउटसाइड, देयर इज अ मैड डॉग एंड इफ द डॉग विल बाइट यू, you 14 injections has to be given to you, है ना. So at that time there was a protocol of giving 14 vaccines. 14, the schedule was having 14. Nowadays the new protocol, I'm telling you, 2018 onwards, the new guidelines, we have maximum 6, not 14, है ना. So वो 14, कुत्ता काटेगा तो 14 इंजेक्शन लगेंगे, बचपन से बहुत सुना है मैंने. But nowadays it is not 14, it is only 6. Let me clarify you, either 6 or 4, है ना, maximum 6. So let me explain the person. Intradermal, total 6 vaccines are given. So total 6 injection, 2 one day. So 2 I will give today, and day 0 is the dog bite, and 2 I will give the next 2. I will give on day 3, and just suppose today is Tuesday. So today is day 0, then 1, 2, 3. Tuesday के बाद Wednesday, Thursday, Friday. I will call the man on Friday, whatever, and day 3 of the dog bite. And the next 2 I will give the day 7 of the dog bite. Got my point? So 2, 2, 2. I will call the man 3 days. And today's first day, then third day, then 7th day. So I will ask the man, I will give you 2 injections today. One on your right deltoid, one on your left deltoid. Again on third day, I will give you 2. Again on 7th day, I will give you 2. Total visits are required 3. 3 visits में काम हो जाएगा, but total injections are 6. 2 at a time, है ना. So this is the first protocol, and every injection will be intradermal. Intradermal is at 180 degree, है ना, between dermis and epidermis. It's like this, है ना. Intramuscular is 90 degree. So man will say, okay, tell me the second protocol. In the second protocol, intramuscular, we will give only 4. Only 4, not 6 injection. Man is saying, ma'am, 6 injection is too much. There is some protocol of having less injection. So I will give there is second protocol. But I will give intramuscular then. It is a deep intramuscular. But I will give you only 4 vaccines. One at a time. 1, 1, 1, 1. So 4 visits are required. First on day 0, second on day 3, third on day 7, and fourth on day 21. समझ में आया क्या? There are 2 protocols. Same, ma'am, intradermal, intramuscular. Both are equally this thing. So here total 3 visits are required, 0, 3, 7. Here 4 are required, 0, 3, 7, 21. Here 2 injections at a time, 2, 2, 2. So total 6. Here 1 at a time, 1, 1, 1, 1. So total 4. What's difficult in that? Learn it. Say yes. Whatever the person say, whatever the person is opting, you can give that schedule. Or whatever available to you, you can start that. But it has to be followed. The protocol has to be followed. People respond, say yes, got it. It was difficult. I tried my best. I tried. What is the date today? Just suppose today is 3rd of October. Now, what is the date today? So today is the first day, 3rd. So 3rd के बाद 4th, 5th, 6th, or 3rd के बाद 4th, 5th, 6th, 7th, 8th, 9th, 10th. So I will write the dates and call the man on that particular day. So we will call and give them vaccines like that. Say yes, got it, everyone. So this is post exposure. Efficacy is very good. post-exposure. Coming on the pre-exposure. Pre-exposure is given to high-risk patients, not to everyone. I have not taken pre-exposure yet. Now I have not taken, thankfully, post-exposure. But there are many mad dogs in our society. Frankly speaking, I get scared of them. Anyways, so post-exposure after the dog bite, I have not taken because still now dog has not bitten me. Anna, pre-exposure also we have not taken because we are not veterinary doctor. We don't come close contact with the animals. But the veterinary doctor or any other people who are in close contact with the animals, they should take it. Here also we have the same two protocol, intradermal, intramuscular. We call the person on 2 days, 0 and 7. And 0 is the day of the vaccination. 0 is not dog bite, day of vaccination. Any day can be started. Hannah, so here only 2, 2, total 4, and 1, 1, total 2 injections are given. I'm summarizing all 4. Post exposure, pre exposure. People listen, listen. So here we call 3 times or 4 times. I'm sorry, just a second. So here we have two regimens, intradermal, intramuscular. Okay, just a second. Intradermal, intramuscular. Here also we have two regimen. I'm sorry. Intradermal, intramuscular. Okay, listen, listen. So here we will call the man 3 times. 0, 3, 7. Here 0, 3, 7 and 21. And here we call only 2 times. 0, 7, 0, 7. Hannah, learn a rule. Learn a rule. The rule is that intradermal is always 2 at a time. 2 injections at a time. So total will be 6. Intramuscular is always 1 at a time. 1 at a time because it is deep now. Deep है तो एक ही दो. Superficial है तो 2 दे दो. है ना? It's like this I have learned. Okay. So you can have 4 at a time. Here also 2 at a time because it is intradermal. So total 4 and 1 at a time. So total 2. How many of you got it? How many of you got it? So learn the total injections. Here it's 6, here it's 4, here it's 4, here it's 2. People say something. Gaya ho to. Got it? Monkey bite. I don't know. Rajat Singh, monkey bite. I have not heard about it. Monkeys are also warm-blooded. Yes, monkey bite will also have the same. Because with the monkey bite also, we are suspecting the rabies only now. Whichever animal bite, if you are suspecting rabies, the vaccination schedule is same. Okay, can we proceed? Okay. Read the question, tell me the answer. We are done with rabies. Chalo fatafat. Negri bodies are found in. Is it hypothalamus, hippocampus, midbrain, or medulla? I told you 2 reasons. No, it is hippocampus and cerebellum, not hypothalamus, hippocampus. So cerebellum hota, so that is also the correct answer, but cerebellum is not there in the option. So we will go with hippocampus. So the correct answer is hippocampus. Okay, Negri bodies. Read the next question. Identify the intracytoplasmic inclusion bodies here in the brain biopsy. In the brain biopsy. In the brain biopsy. Namrata, you can cut that schedule. I guess it is given in your notes. 2-site intramuscular. You will confuse otherwise. Intramuscular में 2 regimens are available, but we follow the 1 site only. 2-site intramuscular you can cut if it is given in your notes. Okay. Yes, of course, the answer is Negri bodies. You can see the answer is Negri bodies. You can see a brain cell. You can see the nucleus, nucleoli, and in the cytoplasm, you can see the Negri bodies. It's a brain biopsy. Got my point? Okay. The correct answer is Negri. You all are too intelligent. Let me tell you, if I remove the word brain, what is your answer now? The same image. What is your answer now? What is the answer now? Answer, if cerebellum 2 is given, they will not give such question, Lalit. Hana? They will give one of them, hippocampus or cerebellum. Both are equally involved. There is no sequence in that, Lalit. Saeed, any animal bite. Protocol is same. Any warm-blooded animal bite. If you are suspecting rabies, this protocol. Protocol is not for animal. Protocol is for rabies. Saeed, got it? So whenever you are suspecting rabies due to any animal bite, the protocol is same. The scheduling is same. Am I live? I'm asking you a question. You are not telling me. Okay, no, don't be sorry. You should ask the questions. It's okay. Why you should be sorry? You should ask your questions. I'm happy that you are asking. Anyways, chalo. What is the answer? Why Queen Lady Shivangi? What is the correct answer? Why D? One has said the D. Everyone will say D. I will slap you all. Why answer D? Tell me the reason. Why A, Aditi? Acha, in the morning I told you na inclusion bodies. Have I taught you inclusion bodies in the morning? Have I taught you inclusion bodies? I taught you three type of inclusion bodies: intracytoplasmic, intranuclear, and both. So I taught you five examples here, five here, quadri A and quadri B, and two here. Huh? Have I taught you? Say yes, say no. Huh? Intracytoplasmic mein what were the examples? Was Paschen body there? Say yes. Negri body there? Say yes. Molluscum Henderson Peterson? Yes. Gunneri? Yes. My point is that they all are intracytoplasmic. So if you remove the word brain, they all are the answers because they all are intracytoplasmic. So A, B, C, D, they all will be the answer. Okay, got my point? Got my point? You people are too much. Got it? So ABCD will all be the answer. So brain is the main word. If you give the word brain, then answer is Negri because Negri occurs in brain. None of them others occurs in the brain. So that is the point. Okay, so that was the concept. Anyways, let's move ahead. So let's move to the next virus. We are done with rhabdo. We are done with polio. We are done with rhabdo. Let's come on orthomyxo and paramyxo. A little bit about them. Small viruses. So quickly we will complete ortho and para, and last is I guess retro. इसके बाद एक retro और है. So let's start orthomyxo. I already taught you bora. Bora is segmented in the morning. बताया था क्या? Bora is segmented. The bora is in pieces. The bora is segmented. O is orthomyxo. O is orthomyxo. Have I taught you? So bora mein, if I taught you ki here we have three fragment, here we 8, 3 plus 8 is 11 and 2. So here we are having 8 fragmented RNA. Have I taught you? Bora ka O is orthomyxo. Here we have 8 fragmented RNA. Count the number of the pieces if you can. Count. It's 1, 2, 3, 4, 5, 6, 7, 8. 8 pieces. You can see 8 pieces. So the hallmark, it comes a image-based question. The image come in your exam and they ask you identify the virus. Yes, very good, Suji. 3, 8. So I'm interested in 8. Bora ka O padha rahi hu main. B-O-R-A. So I'm teaching you orthomyxo. So I want to highlight that 8. So 8 segmented RNA you can see in the image also, correlate in the image also. Okay. Now, have I taught you that viruses, all viruses have nucleic acid. They are surrounded by a protein covering that is capsid, and it is surrounded by an envelope. Some viruses have envelope, some do not have. Some viruses which have envelope on its surface, they have a spiky projection known as papillomer. Have I used this word previously? Papillomer. So this is the first virus I'm telling you it is having the papillomer. See, it is having a papillomer. Papillomer is not present in all viruses, but this is a virus which is having the papillomer. Orthomyxovirus is the virus which is having the papillomer on it. There are two types of papillomers. What are papillomer? The first thing, the papillomer are the spiky projection. There are two types, HA and NA. Both are present on orthomyxovirus. HA is hemagglutinin. The full form is heme, agglutinin, and NA is neuraminidase. Neuraminidase. है ना? Hemagglutinin and neuraminidase. ठीक है? Hemagglutinin and neuraminidase. HA-NA. So you can see one is HA, one is NA. One is HA, one is NA. It's like that. It's like that. Okay. So HA and NA. How many types of HA are there? 15 type. How many type of NA are there? 9 type. How many combinations you can make? You will say, ma'am, H1N1, H1N2, N2H1. There are multiple combinations. So we have many thousands of influenza virus. Thousands of influenza virus. Various combinations are possible because H is of 15 type and N is of 9 type. How many combinations you can make? How many combinations you can make? Okay, yes, all vaccines are primary. Whether it is pre-exposure, post-exposure, vaccine ka matlab primary hai. Okay, vaccine is always primary. So now, okay, so you can understand. So various combinations are possible. H and N. Got my point? Listen, various combinations. Now let me tell you two terms here. Antigenic shift and antigenic drift. Let me tell you two terms. Antigenic shift and antigenic drift. Antigenic shift and antigenic drift. These are the two terms I want to explain you. So see the diagram. See the diagram. Everyone on the screen. Can you see the two viruses? This is a virus, this is a virus. See H and N on their surface. I want you to highlight. See the H and N. See the color, see the shape. See the color, see the shape. H and N is entirely different. They two merge together. The two viruses merge together. Got my point? And see the H and N. So the H and N which are there on the merged virus, it is neither this nor this. A new H and N. The new virus which is formed is novel virus. What is known as like the COVID. We call the COVID a novel virus. It was not present in the world previously. The COVID is formed by merging two different viruses. है ना. The merging is very sudden. It's very sudden, है ना. Virus A was present in the world, virus B was present in the world. That's why people have antibody against this virus, people have antibody against this virus. But when the two viruses merged together and all of a sudden a new novel virus has arrived, the H and N which are present, none of the people in this world have antibody against the H and N present in that virus. That's why the complete world have together infection, and that leads to pandemic. My point is that shifts leads to pandemic. Shift से क्या होता है? Pandemic होता है. Shift से क्या होता है? Pandemic. Shift is sudden and a novel virus is formed. And on the contrary, see the other term. The other term is the drift. The other term is the drift. Drift में क्या होता है? See, only one virus is there, H and N. Gradually, the old H and N are present and the new H and N are coming. Old are also present and gradually the new are coming. They are replacing the old one. So it's gradual, it's slow, it is gradual, it takes years. It leads to epidemic. It leads to epidemic. So tell me the difference. You get many questions on the terms antigenic shift and antigenic drift. Anna, you get questions on that. Say, ma'am, it's sudden. Say, ma'am, it's gradual. This one leads to pandemic and this one leads to epidemic. I guess you know the difference between pandemic and epidemic. Yes, this one, there are three influenza virus A, B, C. This is seen in influenza A, only A. And this one seen in influenza A and B both. My point is that A में pandemic होता है और epidemic भी होता है. A में both, pandemic, epidemic both occur. But B में only epidemic occur. B में only epidemic will occur, pandemic will not occur. Got my point? Got my point? Okay. So please learn the two terms, shift and drift. So you get questions on that. How many of you got it? So that is antigenic shift. So here it is occurring only in A. This one occurring in A and B both. I know. This one is abrupt, sudden, drastic. This one is gradual. This one is gradual. This one leading to pandemics. This one leading to epidemics. Mark in your notes. Please mark. If it is written, please mark. So antigenic shift and drift. We have seen the two terms. I know. So okay. So for the vaccine, what we will do, just suppose, are you vaccinated for flu vaccine? If not, you should get it. If you frequently have the flu, currently also I'm having the flu, you can see it. Hannah. So I'm having a very frequently flu. That's why I take the flu vaccine, although it is not working anything. But flu vaccine, it should be vaccinated. Hannah. But you should ask me a question that, ma'am, you are saying that this is the influenza virus. It is having 8 pieces of RNA. चलो वो भी समझ में आया. ठीक है. है ना? It is having H and N on its surface. है ना? You are saying every time H and N keep on changing. Every time H and N keep on changing. So if you give me the vaccine for one virus, but what if the H and N are changed? I will have the antibodies for that particular H and particular N. For example, I'm having antibody for H1N1. But what if H become 2 and N become 3? I don't have antibodies for that. Hannah? Yes, that is the problem. And this is known as antigenic variability. Antigenic variability. That's what we are seeing in COVID also. No? Every time a new strain is arising. Every time. Every nowadays we heard a new strain is there. A new strain is there. So the people who are vaccinated for the old strain, the vaccine is not working for the new strain. So that is a problem. H and N keep on changing. So you are vaccinated for one particular H and N. Your body have the antibodies for that H and N. है ना? But the virus will change. Virus तो क्या करेगा? है ना? It will change its structure. It will change the H. It will change the N. So old vaccine is not useful for the new virus, the new strain. Say yes. So every year, है ना? New vaccine has to be derived. New vaccine. It is the only virus for which every year new vaccine comes. Who declared the strain? WHO. WHO declared. So in the world, in the entire world, the most common strain of the influenza virus जो भी होता है उस particular year का, for example 2023. So 2023 में most common strain जो भी है उसके लिए WHO will declare and every year new vaccine come on 1st March every year. So you should vaccinate yourself after the March, है ना? Every year new vaccine, every year. So every year you should be vaccinated. It is not you once I'm vaccinated I'm forever. It is for 1 year. Got my point? Got my point? So that is the thing. So please highlight the word every year new vaccine come. Got it? The paramyxovirus. Paramyxovirus also have H and N. Like myxovirus, it is also having H, it is also having N, but it is not showing shift and drift. The H and N are fixed. The H and N are fixed. They do not show the variability. They have H, they have N, but like orthomyxo, they are antigenically stable. They are not antigenically fragile. No, they are stable. है ना? How many type of paramyxovirus are there? There are many paramyxovirus, but we will see only mumps and measles. Measles and mumps, the important one we will see. So let's start with the mumps. Paramyxo में mumps. Mumps में you will get a question on the parotid swelling. You will always get a question on the parotid swelling. The boy have a parotid swelling. The question will start like this: either the parotid swelling, or they will see the swelling in front of the ears. The swelling in front of the ears. In front of the ears, we have parotid gland. We have parotid gland. So typical clue in the question. The clinical course in the mumps start with the parotid swelling. After the parotid swelling, the next organ, if it is a boy, the next organ is testes, orchitis, and epididymitis. The next organ. And after that, meningitis. If it is a girl, directly meningitis. And not girls don't have testes. So learn the sequence. First parotid, parotid swelling, then orchitis and epididymitis, and then meningitis, followed by multiple organs. You may be knowing, PSM maybe I have given you a list of all the strains of entire vaccines. Have I given you that list? The vaccine here is Jarrell-Lin strain. The name of the vaccine is Jarrell-Lin strain. MMR में one of the M is mumps. Got it? Measles में the story always start with the Koplik spot. Mumps में the story start with the parotid swelling. Measles में the story always start with the Koplik spot. What are Koplik spot? In our teeth we have molar teeth, the last teeth, है ना? Molar teeth के सामने वाला बकल mucosa. So this portion from inside, not outside. So this portion from inside, है ना? So the buccal mucosa front of molar tooth. First and second molar tooth के सामने जो buccal mucosa है, whitish spots are there. Can you notice the white color spots? The white colored spots in the buccal mucosa, which is in front of the molar teeth. These are known as Koplik spots. So always first Koplik spots occur. After that, maculopapular rash, second. And number 3, otitis media. Learn the sequence. है ना? So that is. And here also, MMR में one of the M is measles. Diagnosis, you know, measles में पता है ना? Measles में, you may be knowing ना, Warden Finkedley bodies. I mean, inclusion bodies in nucleus as well as cytoplasm. I already told you. Read the question, tell me the answer. Read the question. There is a child has presented the pediatric emergency unit with a 4-day fever. 4-day fever. On oral examination, whitish spots are seen. ठीक है, whitish spots, the image is given to you. है ना? So first identify the virus and tell me the nuclear structure of the virus. First identify. So looking at the image, you can identify the Koplik spots are there. And Koplik spots occurs in measles. So my diagnosis is measles. Now measles is a member of paramyxo. So you tell me paramyxo is DNA or RNA. पहले तो बताओ DNA है कि RNA है? So of course it's RNA. RNA में single stranded कि double stranded? We know all RNA are single stranded except Rio. So this is not Rio. So correct answer is A. So this is a step-by-step approach based question. Yes. So the last virus, finally, retrovirus, last 15 minutes. Okay? So retrovirus is HIV. Let's start retrovirus, the last virus, HIV. The last virus. Let me start HIV. Okay, G, can we start? Last 15-20 minutes. So HIV. Retroviridae, it is HIV. I know, you can see the diagram of the HIV. In the diagram of the HIV, you can see 2 copies of the RNA. 2 copies of the RNA. It is not fragmented. It is having 2 copies of the RNA. It is single-stranded RNA, number 1. Hana, it is having an envelope. On the envelope, 2 glycoproteins are present, GP120 and GP41. Glycoprotein 120, glycoprotein 41. Can you see? This is 120, a knob-like. And this is 41, the projectile. Hana? So GP120, GP41 are present on the envelope. Hana? And there is a core. Core में 2 pieces of RNA are there and enzymes are attached on the RNA. Hana? 2 pieces of RNA तो है ही है. उसके साथ 3 enzymes are attached. Can you see? These are the enzymes attached. These are the enzymes which are attached with the RNA. है ना? So it is reverse transcriptase, integrase and protease. Reverse transcriptase, integrase and protease. The 3 type of enzymes which are attached here. Got my point? So this is the diagram. First draw a core inside which draw the 2 copies of the RNA. On the 2 copies of the RNA, 3 enzymes are attached. Which 3 enzymes? Same ma'am, reverse transcriptase, protease, integrase. They are attached on the RNA. This is capsid. Capsid is surrounded by the envelope. We have an envelope here. On the envelope, we have 2 glycoprotein. है ना? This is GP120, glycoprotein 120. This is GP40. है ना? We have these. We have these like, so this is the structure. First understand the structure. If you understand the structure, things are very simple. Okay. Now understand the genes. Total 9 genes are present. Can you see the RNA? Inside the 2 copies of the RNA, 9 genes are there. 9. 3 of them are ultra important structural genes. 3. So the name of the 3 genes is GAG, POL, and INV. GAG, है ना? POL and INV, है ना? Apart from that, 6 regulatory genes are there. You don't learn that. Just have a look. These are the regulatory genes. So total 9 genes are there. 3 structural are important. You have to tell me which gene is forming which portion of the virus. You can see the virus. देखो नाम में ही है INV. INV is envelope. INV आया ही word envelope से. Envelope का INV. INV is making envelope. So envelope में glycoprotein 120 and 41. Both of them are formed by the INV. So INV is making envelope. There is no doubt in that. Pol से मुझे याद आता है polymerase. Pol मतलब polymerase. Polymerase is an enzyme. So it is making all 3 enzymes. है ना? Reverse transcriptase, है ना? Integrase and protease. All the 3 enzymes. Pol and GAG. GAG से याद आता है core, the capsid. ये जो capsid दिख रहा है ना तुम्हें? The capsid, the core. The shell and the core is formed by the GAG. So there are total 9 genes, but for us 3 are important. 3 of them are structural, I mean. 3 of them are structural. What are the 3 structural genes? Same name, GAG, है ना? POL and INV. ठीक है? So INV से बनता है envelope. Envelope. And there are 2 things, GP120 and GP41. These 2 things are in the envelope. POL में enzymes, all the 3 enzymes. Reverse transcriptase, protease, integrase. Okay, ji. And GAG is shell. The GAG is shell. Got my point? The GAG is shell. Got it? How many types of HIV is there? There is 2 types of HIV. HIV1, HIV2. There are 2 types of HIV. HIV1, HIV2. HIV1 is much more common than 2. है ना? HIV1 is further of 3 types. M, N, and O. MNO. The 3 types of HIV. है ना? M is further of 11 types. 11. You can see A to K. A to K. There are 11 types having further subtypes. है ना? Most common is C, which is present in India. So just have a look on the classification. Most important is the mode of transmission. What is the mode of transmission in HIV? There are 4 modes of transmission in HIV. Please understand. There are 4 modes of transmission in HIV. Blood transfusion. See, this is sexual. Sexual route is there. है ना? Blood transfusion. है ना? Via the blood. Blood is coming from the blood bank. So this route is very less nowadays. है ना? Most common is sexual. Most common is sexual. You are getting my point. Apart from that, percutaneous. So high risk to the doctors and healthcare providers. If you have a needle prick injury and you have used that needle in some HIV positive patient, with the same needle you have an injury, with the same scalpel you have the cut, then it can occur. And the next is the perinatal. So what are the 4 modes? First tell me the 4 modes. हैं कौन से? Blood, sexual, percutaneous, and vertical. I have shown you the images of all 4. समझ में आई? Cannot listen. मैं एक चीज समझा रही हूँ. Try to understand. No, it's difficult. You tell me from the total 100% transmission, out of the 4 routes, which is maximum. Out of the 100% transmission, 75% is transmitted via sexual route. Out of the total 100% transmission, 75 alone is sexual. Sexual is the most common route of transmission. Sexual में भी 3 options are there: vaginal, anal, and oral. Vaginal sex, anal, and oral sex, है ना? उसमें भी most common is vaginal, male to female, vaginal, है ना? So that is the most common route. ठीक है, we got that, है ना? What is the second most common? Second are equal, 10 and 10, है ना? 10 is percutaneous and 10 is vertical. Both are 10. So 75, 85, 95. Total 95 is done, है ना? These both are equal. Percutaneous is through needle prick, है ना? And vertical is from placenta, from mother to child during pregnancy. And only 5% is blood. Only total is 100. See, total is 100. Only 5. Why only 5%? Because blood is always given through blood bank. Blood bank always screen HIV. If I am a donor, you are a receiver, we cannot exchange directly. We will give the blood first to the blood bank. Blood bank will screen the blood and then give to the receiver. If it is found HIV positive, discard, simply discard. Don't even think, discard. So rarely, if some blood bank is doing some mistake or unethically the patients are transferring the blood among themselves without informing the blood bank, then it can occur. So it's very rare, 5%, only 5%. Say yes. So what is the percentage wise? So most common kya hai? Sexual 75%, है ना. सेकंड क्या है, सेकंड दोनों इक्वल है, वर्टिकल एंड पैरेंट्रल बोथ आर 10-10, है ना. एंड रेयर इज blood transfusion. Blood transfusion is only 5. Say yes, say yes. You have to learn the percentage. Say yes, है ना. लेकिन see the twist in the story. See, so maximum is sexual, minimum is blood transfusion. Okay. In percutaneous, we are aware that the person is it prevented in that case? Prevented means whenever we operate a HIV positive patient, whenever we do the surgery, we wear double gloves. Anna, we are more aware कि कट ना लगे. Anna, we are more aware, and we wear goggles also. We wear shoes also. We are completely covered. So none of our area get exposed to the blood. So we do that thing. Yes, we do. But still, हो तो सकता ही है ना cut anytime. We howsoever we precaution take. और let me tell you one more thing. है ना, जितना ज्यादा प्रिकॉशन लेते हो उसी केस में गड़बड़ होता है. आई हैव सीन दैट, है ना. HIV पॉजिटिव है, तुम जितना प्रिकॉशन लोगे, डबल ट्रिपल गॉगल ये वो, उसी में लगेगा, बिकॉज यू आर वेरी मच दिस अबाउट दैट, है ना. सो एनीवेज, चलो लेट मी टेल यू वन मोर थिंग. रिस्क ऑफ ट्रांसमिशन. What is risk of transmission? What is? I agree that sexual route is most common, 75%. I agree. But per coitus, per penetration, or per coitus, the chance is only 0.1%. You're getting my point? Most common is that, but per coitus or per sexual intercourse, I'm saying, per penetration, the chance is 1%, 0.1 to 1%. You got my point? Blood transfusion is only 5%. टोटल का 5% ही है. आई एग्री. लेकिन अगर किसी को ब्लड मिल गया HIV पॉजिटिव, तो 90% चांस है कि उसको HIV होगा ही होगा, है ना. सेक्सुअल रूट मोस्ट कॉमन है. आई एग्री. टोटल का 75% सेक्सुअल से ही होता है. लेकिन जस्ट सपोज एक HIV पॉजिटिव मेल है, HIV पॉजिटिव है मेल, और फीमेल इज हेल्दी. They have sexual intercourse between them, है ना. The male is positive, the female is healthy. After intercourse, per penetration, है ना, there is only 0.1 to 1% chance now she will have HIV per penetration. But depending how many penetrations, how many coitus is there, how many intercourse, how many times is there. But per coitus it's only 1%, maximum 1, I mean, है ना. But imagine there is a person who is HIV positive, है ना. There is another person who is HIV negative, I mean who is healthy. He is HIV positive and he is healthy, and blood is given of this to this. 90% chances there इसको HIV होगा ही होगा. 90%. That is the risk of transmission. You got my point? So tell me the two routes, है ना. Sexual, BT, blood transfusion. Tell me, which is more common, which is less common. I mean the percentage risk of transmission wise and common wise. So common wise आप बोलोगे तो this is 75, this is only 5. But risk of transmission, this is only 0.1 to 1, and this one is 90, more than 90. So here, this is maximum, this is minimum. Here, this is maximum, this is minimum. I tried. At least I tried. You got my point? So please understand your question very carefully. I will show you question also. Question में समझ में आएगा. Got my point? So Kartika, that is a different thing. Per coitus we are talking now. We are talking per BT, per coitus. Per BT में कितना chance है? 90%. Per coitus में कितना chance है? 0.1 to 1%. We are talking per one में. है ना. Okay, that is the thing. So that is the thing written in front of you. Most common, it's 75 sexual, but the risk of transmission per coitus is only 1. Blood transfusion is the least common, only 5%, but risk of transmission is 90 to 95. I hope you all got it. Percutaneous is there, and perinatal mode is also there. Hannah, now let me tell you how does the virus replicate inside the host cell. Hannah, how does the virus replicate inside the host cell? I will draw it rather than explaining. Let me draw a human cell. Which is CD4 lymphocyte, है ना. So this is human का, है ना, CD4 lymphocyte having double stranded DNA. So this cell is CD4 lymphocyte of human, the host cell, है ना, the host cell of the virus, and this is HIV virus. ठीक है. This is RNA. It is having RNA inside it, 2 copies of RNA. So this will replicate inside this. Viruses cannot replicate outside the host cell. So for entering, 2 bonds are required. है ना. One is main, one is co-receptor. One is main receptor, one is co-receptor. Please understand it. It's difficult. Listen, main receptor, GP120 of here will bind CD4 of here. CD4. So this bonding is known as main bonding. Main bonding is for attachment. This is responsible for attachment. Say yes. Everyone say here. So GP120 of the virus bind with CD4 receptor of the lymphocyte, of the T lymphocyte. Say yes. This is main bonding and it is required for attachment. Now let me tell you the co-receptor, co-binding. In the co-binding, again GP120. यहाँ का तो अभी भी GP120 है. GP120 is binding with what? Now, if it is a T lymphocyte, here the co-receptor is CXCR4. And if it is a macrophage, there are two type of cell the virus affect. T lymphocyte को भी affect करता है, macrophage को भी करता है. In macrophage, it is CCR5, the name of the receptor. So here, the glycoprotein 120 forming bond either with this or with this. This is known as co-receptor. This bonding is known as co-receptor. This is required for fusion. And also this one is required for attachment. This one is required for fusion. How many of you got it? How many of you got it? This one is present in T lymphocytes. And this one is present in macrophage. So one of them will be there. Now, either this cell is T lymphocyte or this cell is macrophage. In macrophage also CD4 receptor is present. Say people, yes, say, I'm trying very hard. Please appreciate it. So learn the main bond. Learn the main bond and learn the co-bond. You learn main bond is for attachment and co is for fusion. Okay, G, you get questions on that? Same thing is written. See the main. See first main. Main is between what and what? GP120 of the virus, CD4 of the host cell. See the same, not very clearly seen. CD4 of the host and GP120 of the virus. This is main, not very clearly seen. And co-receptor. I told you here again GP120. यहाँ का तो GP120 है. लेकिन either CXCR4 or CCR5. Depending T lymphocyte or macrophage. You can see CCR5, CXCR4. Say yes, people. Got it? Now, there are some lucky people in which CCR5 is mutated. CCR5 is mutated. So even if they are HIV infected, they can't have the AIDS. Fusion is not possible in them. So there is a subset of people in which CCR5 is mutated. Let me tell you the life cycle. Everyone on the screen. Everyone. Can you see the cell? Okay, let me highlight. Can you see this cell? This cell is CD4 T lymphocyte of the human. Appreciate the cell. And appreciate the virus now. Appreciate the virus is coming and binding the cell. Please see. So first main bond is formed. You know between what and what. Then co-bond is formed. You know between what and what. So first attachment, then fusion. First attachment, then fusion. After that, the virus will penetrate. After both the bond, the virus will penetrate. Say yes. So third step is penetration. Whenever the virus is penetrating, after going inside, the RNA is present. Virus have RNA. And the host cell, human cell have double-stranded DNA. This is double-stranded DNA of the human. Human with the double-stranded DNA hota hai. But the virus have RNA. RNA cannot fuse with DNA. That's why the virus have an enzyme reverse transcriptase. I told you 3 enzymes now, reverse transcriptase, integrase and protease. So one of them, reverse transcriptase, convert the RNA of the virus to the DNA of the virus. Complementary DNA. And now this DNA will go inside and fuse with the host DNA. So host DNA and virus DNA fuse with each other. Host DNA, matlab human DNA and virus DNA. You will say, virus mein to DNA hai nahi, it's RNA virus. So the reverse transcriptase is the enzyme that convert the RNA of the virus to the DNA of the virus inside the host cell. Say, इसलिए उसका नाम है reverse transcriptase. It is converting RNA to DNA in the virus, and the DNA is going inside the nucleus and it is integrating with the host. Say yes. The integrated. This is known as prophase. Prophase. It is known as prophase. The integrated version. It is latent. Nearly 10 years it will be like this only. 3 to 10 years it will be in latency. Variable in the people. 3 to 10 years it will be latent. Nothing. The patient is HIV positive but no AIDS. The patient is HIV positive, infected with HIV, but AIDS is not there. After 3 to 10 years, after multiple progenies are formed, it will replicate and it will rupture the CD4 T lymphocyte and a daughter virion is coming out. By rupturing, it is coming out. So after 10 years, the CD4 count drop because it is keep on rupturing, and it is dropping. The patient will have immunosuppression and the patient will present with AIDS. The patient, so same story is written. First, main bond, then co-bond, main bond bana, co-bond bana, then penetration. After that, the RNA converted to complementary DNA by reverse transcriptase. Then DNA will enter in the nucleus. After that, it will integrate. For integration, the integrase enzyme is required. It will integrate and a provirus is formed. It will remain latent for several years. That is latency. And after latency, several copies are formed. It will rupture and come out. Say yes. Got it? So that is the thing. So that is the important things in HIV. Okay, read the question, tell me the answer. We are done. Read the question. The gene coding for HIV. Tell me the answer. The gene coding for HIV. What I'm asking, I'm sorry. The gene coding for the core of the HIV, I'm sorry. Is it gag, in, pore, or tat? I'm asking the core. Core matlab capsid. The capsid is formed by the gag. If I change the question and do it GP120, what is the answer? What is the answer? GP120 is present in envelope, so my answer will be in. Or GP40, 41, again my answer will be envelope. If I change it to the enzyme, reverse transcriptase, integrase, protease, so my answer will be full. So depending on that, I will keep on changing the answer. Now read the question carefully. Galti nahi karna. I'm asking risk of transmission. Highest risk of transmission. I'm not asking most common route. Mind it, I'm not asking most common route. I'm asking risk of transmission. Maximum risk of transmission is blood. I know 95%, 90 to 95%. Although it's rare, only 5%. But maximum risk of transmission. Read the next question. Most common route. Most common route. In that case, your answer will become sexual. So I hope you understood the difference between the two. GP120 is required for what? Fusion ki penetration ki attachment ki integration. GP120 is required for what? So GP120 is for attachment, है ना? If I change the question to GP41, answer will be fusion. So 120 is for attachment and 41 is for fusion. Okay, G, we are done. We are done with complete virology. So till now, complete general, complete immuno, not complete immuno, few topics are left. Anyways, complete bacteria, complete virus done. Okay, now two sections are more left, parasito and myco. पैरासाइटो रिक्वायर 1 hour और मैक्सिमम 1 hour 15 minutes है ना ठीक है और ज्यादा ब्रेक लेके किया तो 1 hour 30 minutes उससे ज्यादा नहीं लगेगा माइक्रो इज अ वेरी स्मॉल सेक्शन ठीक है एंड parasite to require 5 hours 4 hours maybe and a 4 to 5 hours it requires so tomorrow complete day we are going to complete it anything else you want to say what is left what you're saying covid the vaccines have an immune date tomorrow है ना we are not left any general micro part. Tirupati, if it is left, kindly mention which part. I have completed general. Nothing is left. Immuno is left. I guess you are getting confused. Tirupati. What else? Okay. Anything else? Anything else you want to say? You tell me your schedule. So tomorrow is 4th now. Yeah, tomorrow is 4th. What you are having on 5th? I'm asking you just. What you are having on the 5th? Tomorrow is my class. I know. Micro last day. Day 4. What you are having on 5th in your schedule? You are having micro test only. And what you are having on 6th? Okay, let me ask the team. I was just thinking to have a break tomorrow and can we take the 4th day on 5th? If it is possible, just because of my throat condition. But if it is not possible, I will not delay. I will take it tomorrow only. So however I am taking today, I will take tomorrow also. Okay, so don't worry. Let me discuss with the team if it is possible. So it is comfortable to you if we take a break tomorrow and take the class on 5th, not tomorrow. But when you will give the test? Sterilization I will take. Thanks for reminding Tirupati. I forgot the sterilization I will take. So let me ask the team if it is possible. You people don't have any problem now, but there should be a schedule now. So if I give a break tomorrow, just suppose, and if I take day 4, day 4 of micro on 5th, so where you will schedule the test. So let me discuss with the team. You are compulsory, you have to take the test also, na? No, I'm okay. So ye to chalta rehta hai. It's not a very big deal with me. So let's discuss. If it is comfortably possible, we are shifting. But if a little bit trouble is there and you are compromising anyway, so I do not want that. We will finish it off tomorrow only. Take care. So let me discuss and I will inform you. I will inform means the team will inform you, right? Anyways, if you are taking the class tomorrow also we are starting at 9:30. 9:30 to 6:30, 7, whatever. ठीक है जी. So tomorrow, है ना? Probably tomorrow ही है. Let me discuss. ठीक है जी. Okay, done. Thank you so much. Bye bye. Yeah. So I will continue tomorrow only. Mostly 99% I will continue tomorrow. So the timing is 9:30. We will start with Myco. I do not want to delay because I don't know about your schedule, but I'm having a very hectic schedule. I'm having another classes scheduled on 5th, 6th, 7th. So where I will adjust those classes, that is a trouble for me. So even I do not want to delay. I want to just finish it tomorrow only. है ना? So तुम्हारे से ज़्यादा मेरा schedule बहुत busy है अभी currently तो. So I will schedule tomorrow. Don't worry. So tomorrow 9:30 Maiko. Start with Maiko 9:30 to 10:30, and 10:30 onwards we are going with Parasite. Okay, Ji. Bye bye. See you tomorrow. Bye. I'm ending the session.